Good morning, everyone, and thank you for tuning in for this exciting discussion of our latest report, Nursing the Future, Ensuring a Healthy California with the Diverse Nursing Workforce We Need. And to all the nurses on this call and the faculty who are training our nurses, happy National Nurses Week. I'm Audrey Dow. I'm the Senior Vice President at the Campaign for College Opportunity, and I'm a proud member of the California Health Workforce Education and Training Council. Before we get started, I'd like to thank our report author, Dr. Elsa Macias, Dr. Kathy Flores at the UCSF School of Medicine for her expert review, and the California Wellness Foundation, whose funding made this report possible. I have a few housekeeping items before we do kick off in earnest. First of all, today's webinar will be recorded and will be shared in the coming days via our website and on our social media channels, so definitely look out for that. And later in the program, we'll have audience Q&A, so please be sure to drop your questions in the Q&A box so we can answer them live. I also encourage you to use the chat online using the hashtag nursing the future. The link to the report should be dropped in the chat shortly. This weekend, my oldest daughter, Isabella, graduated with her Bachelor's of Science in Nursing. And what I continue to learn and understand about the profession is the awesome role that nurses play in delivering patient care. Every one of us on this webinar has been served by a nurse. Some perhaps in our happiest moments, like the birth of a baby, some more likely in our lowest or scariest moments when we're sick or a loved one dies. Nurses are our health educators, taking our symptoms and helping us make sense of them, guiding us in better lifestyle practices from eating, exercising to important safety precautions like, yes, wearing that bicycle helmet. Nurses are the face of our collective healthcare and are the frontline workers advancing the health of California's population. Yet the state faces significant nursing shortages over the next 5 years, despite recent state and federal investments and improvement in workforce shortages in other health professions. The campaign published Nursing the Future to illuminate some of the challenges within our own higher education system here in California that are contributing to the nursing workforce shortage, while making recommendations on how those challenges might be met. Indeed, they must be met for all of our sakes. So I'm excited to be here today to hear from our stellar panelists who are working on these issues every single day. And more importantly, to learn what we can collectively do to ensure a robust, diverse nursing workforce for our state. So now to review the report findings, it's my pleasure to introduce one of my very favorite colleagues, our Vice President of Research, Dr. Vikash Reddy.
Thank you so much, Audrey. Audrey said one of her favorites, but I know I am the favorite colleague. So thank you so much. I also want to thank Elsa Macias for the work that she did on this brief, as well as the team in-house who reviewed it and who helped us make this a reality. And of course, our external reviewers who were critical in ensuring that we had our data and our information correct and our interpretations correct. California faces a couple of different problems with our nursing in terms of thinking about the future of our nursing workforce. The first one that Audrey mentioned is that we're looking at some immense shortages over the next few years. In 2020, actually, we had about 350,000 registered nurses in the state, with a projection that by 2035, we would need just shy of 500,000. Over the course of the pandemic, and we'll talk a little bit more about that in the slides to come, we saw a dramatic reduction in the workforce and some dramatic impacts on the nursing workforce. I think we all remember the early days in particular that were incredibly intense, and the working conditions. And at this point, we're actually projected to have about a gap of around 40,000, 45,000 nurses through around at least 2026. So this is an incredible problem that we know that we need to address. The other problem that we need to address is showcased in this slide that you see on the screen right now. The nursing workforce simply doesn't reflect California's tremendous diversity. About 40% of our population is Latinx in the state, just shy 39%, but only 10% of registered nurses in the state are Latinx. We see similar difficulties among other parts of our medical workforce with, in terms of physicians, nursing across the board, except with the one exception of our LVN population, which does slightly better reflect the state's population. This is a problem because we know that physicians, a diverse physician and nursing workforce is a requirement for having better care for our state's residents. Physicians and nurses of color can provide more culturally competent care. We've seen research that suggests that when patients have a racial match with their healthcare provider, they have higher levels of communication. We've seen research that shows that Black babies with Black doctors have infant mortality rates that are roughly cut in half. The next slide, though, shows that the COVID-19 pandemic, in addition to having a tremendous impact on our nursing workforce, had a tremendous impact on our applications to nursing or our enrollments in nursing programs. We were seeing consistent rising enrollment from 2016 through about 2020. Or 2019, 2020. And as I mentioned, in around 2020, it looked like we were on path to meet future projections. And we see that as a result of the onset of COVID-19, those numbers have fallen. That said, we haven't seen a drop in the interest in the profession until more recently. We've seen maybe a leveling off in the most recent year, but the number of qualified applicants to California programs has been rising consistently. That said, something like 72% of qualified applicants to nursing admissions programs were denied admissions in the 2020-2021 school year. And another thing that we're going to talk about in a minute is actually also the increase of the growth in the need for a Bachelor's of Science in Nursing, or the BSN degree. And we see even there the low rates of admission and difficulty accessing that pathway. Speaking of the pathway, California has about 140 nursing schools, 139 to be precise. 69% of those are public, 31% are private. 43 offer a BSN degree. And there are 92 that have an ADN, the Associate Degree for Nursing, or an LVN to ADN program, a Licensed Vocational Nurse to Associate Degree for Nursing program. The Cal State University has 19 BSN programs, and they have 10 of the ADN to BSN, and those are Associate Degree to Nursing, Associate Degree for Nursing to Bachelor's of Science in Nursing program, pathway programs that streamline processes for students who are looking to transfer from community college to Cal State University. And the California community colleges have 77 RN programs among their 115 community college campuses. So there's no dearth of programs, but of course, capacity within these programs to admit and enroll students is one of the problems that we see with our growth in the nursing workforce. I mentioned the pandemic already. We know that the nurses in our hospitals and in our healthcare facilities were playing a gigantic, heroic role in our response to the pandemic. And we've talked a little bit about the impact that had on current and current employment trends with nurses who were nearing retirement age, becoming more likely to take retirement, and a problem or sort of a decline in entrance into the profession. One of the issues with entry into the profession induced by the pandemic were the struggles with online learning that our colleges saw as they transitioned rapidly to online learning. And of course, online learning for a nursing program that requires clinical placements is going to be an incredibly challenging proposition. And on top of that, there aren't quite enough clinical placements for all of the enrollment capacity that we see, right? We see a need to grow clinical enrollment capacity for programs for degree programs in the state. We also see faculty or shortage of faculty, and a problem here being competition for faculty, as well as the fact that a nurse in the workforce can make nearly twice as much as somebody who's in the nursing faculty workforce. And of course, we see increased competition among hospitals and the cost of hiring nurses as wages justifiably increase. I also mentioned that the Bachelor's of Science in Nursing, the BSN, is now becoming something of a new standard of employment for nurses in the profession. And this has incredible implications for populations where time to degree might be a little bit longer, and also populations that are more reliant on transfer programs. And we know that in particular, both of these populations tend to be Black, Latinx, or other students of color. And so as we transition to this healthcare system in which the BSN really does become more the standard of care, or the standard, I should say, of employment, it's important for us to think about support for nursing students who are looking for this degree, and support for students who start at California community colleges and who are looking to transfer to a Cal State or a private institution and earn a BSN degree. One additional component of the shortage in workforce, or the diversity issue that we see in the nursing workforce, is a regional one, where across the state we see definitely a lack of diversity and a need to diversify our nursing workforce, but we see this much more prevalently in some regions than others, right? And so in Los Angeles, for example, we do see probably the most diverse, with 33%, 1 in 3 of our nurses is identified as white, and 2 in 3 as a person of color. And across the rest of the state, however, I think it's important that we note that we need to try to improve the diversity of our nursing workforce to, as I mentioned, improve the culturally competent care that our healthcare providers are giving our state's residents. This report advances about 8 policy recommendations. Our first is to take a really critical examination of the barriers to admission to programs at community colleges and Cal State universities, and at private colleges as well, to see what are the barriers to admissions, what are the barriers to equity, and where are the ways that we can modify or amend or change about our admissions processes to ensure that we're admitting enough students, enrolling enough students, and making sure that that's a diverse enough pool. The second thing that we talk about in our report is investing in accelerated nursing programs for students who are certain of their career path early on. We recommend to expand and scale partnerships between the Cal State universities and the California community colleges to make sure that there are strong transfer pathways for students who start at the community colleges. At a federal level, we want to see increased funding for nursing and nursing programs to increase clinical placement and increase enrollment capacity. Ensure that the cradle to career data system is capturing data on eligible but not accepted students who apply to nursing programs in the state. On relicensure questionnaires, we'd like to see additional questions on location employment and nature of employment included in those questionnaires. And we think we need to invest more in nursing faculty. We need to raise salaries and other forms of compensation to ensure that that's a competitive labor market option, and also invest in clinical training sites so that every nursing student has the potential to get the clinical training hours that they need, and ensure that they can get to graduation in a timely fashion. I've gone through that all remarkably quickly as I could, because I think that, number one, this data is available in the report, which is available online. And I would invite you also to take a look at our previous report on this topic, Critical Conditions, in which we talk about actually the pathway from the community colleges to the Cal State universities, and we'll drop that link in the chat shortly. But I think the main event here is the panel that Audrey Dow is going to lead you through. I look forward to coming back for the question and answer session when my time comes. But right now, Audrey, I think you've got some experts and some students to tell us about the real issues that we're facing.
Thank you so much, Vikash. Definitely some sobering data that we heard, and quite the challenge I think that's before us. We are so lucky today to really have a stellar panel, as I shared earlier, of individuals who are working on issues of health workforce shortage, particularly in the nursing field, day in and day out. Whether it be from a state perspective, working on issues of policy, working directly with nurses via the nurses union, working on a college campus to train nurses, And as Vikas shared, we also have a student with us, a current nursing student who is navigating her way through the pipeline with the goal of becoming a nurse. And so I'm going to introduce all of our panelists first off, and then we will kick off with the questions. So I would like to introduce first Dr. Elizabeth Landsberg, who's the director of the California Department of Healthcare Access and Information. Catherine oversees at that department really the state's largest initiatives focused on healthcare workforce. So thank you, Dr. Landsberg, for being with us today. I would like to introduce Catherine Kennedy, who is the president of the California Nurses Association, the National Nurses Organizing Committee, and is also the vice president of the National Nurses United. Thank you, Catherine, for being with us. And just a side note, Catherine Kennedy is one of those people who sees aspiring nurses and will take out of her valuable time anytime she can give to mentor those students to ensure that they make it through to and through the profession. So thank you, Catherine, for everything you do. Next, we have SHERI BERGER, who is the Vice President of Academic Affairs at Compton College. Compton is doing some really innovative work down here in Southern California to ensure that students are coming through the nursing pipeline, finding spots, but then going directly to work in the community of Compton to serve those individuals who have historically been marginalized, underrepresented, and who often suffer from some of the largest health challenges we face in our state. So thank you, SHERI, for being with us today. And last but not least is JAZMIN GUAJARDO. She is a nursing major at CSU Channel Islands and is also the vice president of the Associated Students Incorporated at CSU Channel Islands. Thank you so much, JAZMIN, for being with us today. Let's get started. Are you ready, lady? First question to you, Catherine, as probably our longest standing nurse on the panel. The first question for you is, what does the nursing shortage look like in reality?
Sure. Well, thank you very much for having me here. And yes, I've been working as a registered nurse, and I continue to work as a frontline staff nurse in a neonatal intensive care unit at Kaiser Roseville here in Northern California. The reality of the shortage, it's really, I think it's hospital industry made. There are nurses that are choosing, to leave the profession because of the current working conditions. The COVID pandemic really showed us that hospitals really need to provide support for the nurses. And that is the one thing that we continue to push. I've been a nurse for 43 years, and this by far has been the worst that I've seen. And it has shown us that we need to, for new nurses coming on board, to make sure that hospitals have put the funding into supporting not only new nurses such as JAZMIN when she gets ready to come on board onto hospital work, if that's what she chooses to do, but also mentoring, providing mentoring, and making sure that we have nurses that are successful. I went through 2 different cross-training programs in my hospital system that I worked for. We know it works. I was a med-surg nurse, then I became an ICU nurse, and then the neonatal intensive care unit, all because the hospital invested in nursing, and it works. So, the shortage, it's more about nurses really wanting to have support. And by having that support, there's longevity. That's the reality.
Thank you so much, Catherine. I'd like to ask our student JAZMIN to speak a little bit about, what is it that you're encountering in the higher education system when a student wants to become a nurse?
What I've noticed currently is that the major is impacted and that it's not as easily accessible to all students. So for me, I am a part of the Education Opportunity Program, which provides priority registration. to certain classes. So if these classes are in high demand, not everyone can get in them. So this program offers that opportunity for me to get in those classes early and on track. And so with that, students aren't able to do that in a timely fashion, which may like prolong their time at a university or anything. And if they have responsibilities like family or multiple jobs or anything, that greatly impacts the way that their educational experience is being handled and achieved. And I've noticed that peer mentor programs are also a contributing factor to the great success of students getting into the program. So students that have peer mentors are able to ask questions, are able to see what the program is really like and whether they need more guidance or any areas that need more work.
Thank you so much, Jasmine. Director Landsberg, I think, we continue to hear, just like Jasmine shared, the fact that we have so many students who are interested in becoming nurses, so many qualified applicants to our systems, yet our students aren't finding spots. I know that, Catherine talked a lot about the fact that during the pandemic, we saw nurses leaving the practice after what was clearly 2 years of probably significant burnout. I know that we don't have the clinical placement and the faculty to be teaching our new generation of nursing. So from your lens, really at this statewide level, what are some of the budgetary and programmatic efforts that the state is doing or can do to really ensure that we continue to have a robust pipeline of nurses?
Thanks very much, Audrey, and it's great to be on this panel with all of you. Where this is something near and dear to my heart, and something that's important to Secretary Galley, something that the governor is aware of, that we really do have a very serious problem with not enough nurses. So it's wonderful to hear from both Catherine with her 40+ years of veteran and Jasmine coming into the profession. So HCI, Department of Healthcare Access and Information, and Audrey and Catherine know this well because they've been engaged with us for a long time, has long supported the nursing workforce. So everything from pipeline to supporting training programs to supporting individuals. So we have some loan repayment and scholarship programs for different levels of nurses. And we have our Song Brown program, which has supported, again, for many years, ADN, BSN, ELM nursing education programs. We've been really pleased that the legislature has increased the investment. So we awarded $9 million in support for nursing training programs in 2021, 17 million this year. And we also know it's not enough. So I think, the report lays out all the really critical issues of not enough faculty. We have, the folks, we have both a recruitment problem and a retention problem. We know that the pandemic burned folks out. And so just like we're having trouble having nurses in all of the geographic areas where we need them, we also have trouble recruiting nurses to be faculty. So I think, we've been pleased that Audrey and Catherine have been part of the discussions of our Workforce Council of California that's looked at the fact that we need to be supporting not just the training programs, but also clinical placement. How do we support having sufficient clinical placement positions, as well as supporting additional faculty? So recognizing that more needs to be done to support nursing recruitment, training, and retention. The budget last year did include a 21st Century Nursing Initiative with $220 million to address many of the varying challenges facing the nursing workforce that we heard from the report and from others today. So for this initiative, we've created a framework that recommends numerous investments. Unfortunately, I do have to acknowledge that given the $22 billion budget deficit the state is facing, some of that is proposed to be delayed. So we continue to work. If the budget is always an ongoing conversation between the legislature and the governor, but the framework and the recommendations and the report are very similar and really aligns with the framework that we have developed. So we know that we need to really invest additionally in the pipeline, and that we need to help fast track early entry to health professional jobs. We know, and you all have talked about this, healthy work environment focused interventions, including a focus on addressing racial bias and improving retention of diverse workers. So we believe all of HCI's workforce programs are working to develop a healthcare workforce that reflect California's diversity. And so we need to recruit a more diverse group of folks to come in, but then we need to really support them and push to make sure that the curricula are specifically addressing racism and racial bias and cultural competency and cultural humility. We also think it's important to support, to expand some distance campus training programs. Like we know Sac City College, for example, has an LVN to RN program. And then we're very focused as well as increasing the diversity on training nurses in areas where they're most needed. So all our loan repayment and scholarship programs do have a service obligation to serve in a medically underserved area. So we believe the state needs to consider the necessary order of building and supporting the nursing workforce. And also that we need to create that infrastructure. So lots more I could say, but the big goal of this initiative is really to provide some foundational investments, such as those based around clinical placement and faculty, that will make future targeted investments possible and effective.
Thank you so much, Director Landsberg. And we're definitely going to come back to you to dig in on a couple of details that you discussed. But I want to turn it now to SHERI Berger at Compton College, who really is on the ground, right? At ground zero, so to speak, where students are, the vast majority of students in California, we all know, start at a California community college when they go to college. And that pipeline into higher education is critical. And so SHERI, you're at Compton, you have students who want to become nurses. When we look at the data, we know that nursing programs, again, across the state are oversubscribed, but we know that you're doing some really innovative things to support the students in their interest, as well as connecting them with the larger community. So would love to get your thoughts on the discussion and what you see as some of the opportunities and innovative work happening at Compton.
Well, thank you and good morning. Yeah, we fully understand that we don't have enough spots for the students, right? That oversubscribed issue. And there's a lot of reasons for that. Funding being the greatest one. It costs to run a class of 40 nurses, cost me 4 to 5 times what it costs to run a history class. And so we can't just keep growing our nursing programs without the funding to support those programs. But more importantly, we need to, and the work that we're doing in Compton is look at ways to build partnerships and pipelines from starting in middle and high school through community college, through our ADM programs, and into our BSN programs and beyond, so that we can get qualified nurses both to teach and in our hospitals. Compton is a medically underserved area, but I know that at Compton College that we have over half, more than half, almost 60% of those that are graduating in our ADM programs are Latinx and Black students. And we encourage them to work in our community. Our clinical sites are in our community. But part of this building this partnership in Compton, we are building a community health professions partnership that's brought together Assemblyman Mike Gibson. It's brought together our higher ed partners, CSU Dominguez Hills, Charles Drew University. We've brought in Compton Unified School District. We've brought in our healthcare partners, St. John's Community Health, Kedron Health, Martin Luther King Jr. Community Hospital. And we are all working together and engaging in conversations in how we can move forward to reduce the disparities in health outcomes in our community, a community that is anxious about healthcare sometimes in general. During the pandemic, we opened up our St. John's Wellness Center on campus that provides our student health services to the community to provide vaccination and testing to the community. And the community saw the college as a safe place to go and get that medical care. And so one of the other things that we're doing is Dr. Keith Curry, our president and CEO at Compton College, has just written a letter of support for St. John's to build a community medical facility on our campus. that would provide 24/7, 365 care. Of course, funding permitted. But to give that care to our students, but also to our community, and also to help with the challenge that we have in finding those clinical placement sites, right? You know, in the California community colleges, we don't pay to be part of those clinical sites. The hospitals and other facilities invite us in, but we know that the for-profit sector does pay to get into those slots. And that hurts all of us because we are providing that education at a much more financially responsible approach for students. And nursing programs for students, even at community colleges where it's only $46 a unit, still there's uniforms and nursing kits and all of these other things that do add up in the cost. So we are looking for ways. We are appreciative of the Song Brown grant. We are a recipient of that. And we do use it for our new ADN students. And we do have an LVN to ADN pathway. And looking at those pipelines into those BSN programs, that's why our partnership, especially with Charles Drew and CSU Dominguez Hills, is critical in building and establishing those pipelines.
Thank you so much, SHERI. We are so, again, excited about the work that Compton is doing in the community. I want to go back to Catherine Kennedy for a minute. I think Director Landsberg talked about creating environments where our nurses want to stay, that are culturally competent, that are places that are healthy for them to work in. What are some of those efforts that you see the field really focused on that are ensuring that we can not just attract but retain a diverse workforce in those medically underserved areas?
Exactly, you know, and as CNA has grown, you know, we represent over 100,000 registered nurses and nurse practitioners in the state of California and our NNOC states. And through bargaining with the health care industry, the hospitals, in our collective bargaining agreements, we actually have agreements where there are equity, inclusion, diversity committees made up of staff nurses, because of course, this is something that we see day in, day out. And it's so important that as a frontline staff nurse, you know exactly what's happening as it relates to those systemic racism things that occur in hospital settings. So that language is in most of our collective bargaining agreements, along with the health and safety protection. COVID really showed us that the employer really was not ready for the pandemic. And frontline nurses, you know, had a seat at the table to really say, this is what we need. So young nurses such as JAZMIN, when she's coming in, we've got those programs, not programs, these committees, these things in our bargaining agreement that to ensure that nurses are not only protected to do their job, that when they experience any kind of racial issues and to increase the diversity of the frontline staff, all of that is part of the collective bargaining agreement. And over the years that I've been a registered nurse, I have seen that. I mean, can we do better? Absolutely. And I think that with what's happening here in the state of California, we are making progress. But we also, as a union, this is something that we insist on. And we have a seat at the table. So that's really important for young nurses coming in.
Thank you so much, Catherine. JAZMIN, if there was one or two things that you could share about your experience with state policymakers, with the governor, with Catherine and Elizabeth on this call, one thing you could share that you think definitely needs to be improved to open up the pipeline for students like you, what would that be? What would be your top recommendation?
I would say my top recommendations are increasing the CSU budget. So that's definitely one. every year, the CSU budget, we lobby in Sacramento to increase or keep it the same as planned. And from personal experience, CSU Channel Islands is a fairly small and younger campus, so we don't have the same resources or facilities as other institutions. Our institution's only 20 years old. So that's almost as old as me. So it's a little complicated, and our resources aren't at the capacity of other universities. So I encourage that to increase. And we also want our instructors to be retained. So we talked about that earlier. So our instructors have to consider whether they want to continue teaching or if they want to continue being a RN or a nurse practitioner, anything like that. And this will increase or positively impact our campuses with increased jobs for staff, faculty, student positions, and increasing our facilities. And overall, I think it will increase the application process because right now our university is only interviewing 70 applicants out of the 900 or thousands of people that apply. So how can we adequately assess who is able to receive that interview? Because we're not able to look at the application and read that person as who they are. And so with those 900 applications, it gets difficult, and that interview can ultimately determine the rest of their life and the patient's life. So that interview has a lot of impact on our society and everything. So if we're able to interview everyone, that would be wonderful and give everyone that equal opportunity. That is ultimately what I would advocate for at the state level as well. So increasing staffing for faculty, for nurses, for increased budgeting, that is everything that I could ultimately ask for.
Thanks so much, Jasmine. Sherry, in a previous report that we did, also looking at healthcare professions, nursing being one of them, we saw that a large number of students going into health careers at our community colleges were not transferring, right? So never making it to that point of even, getting to the bachelor's degree point, whereas, the report really demonstrated this Bachelor of Science in Nursing is kind of the now entry credential to practice in the field. So that transfer function becomes incredibly important. What is Compton doing to ensure students in the health professions, and in particular nurses, are, from the time they indicate that that is the route they want to go into, how do you ensure that they actually cross that transfer line?
Yeah, thank you. This has been a challenge for us. We're looking at that pipeline and in conversations with Cal State Dominguez Hills to see how we can facilitate something like that. The other thing that we've done is this summer, we are starting what is called in reference as a 3-year bachelor degree. And what this program is we're starting with incoming 11th graders are starting on a pathway, and they'll complete a year of their bachelor's degree in the 11th and 12th grade, transition to Compton College for a year, and then move on to Charles Drew University in an allied health field, and they'll be able to get their bachelor's of science in biomedical science, public health, or psychology with an emphasis in community counseling. And these are all health-related fields, not nursing specifically. Charles Drew University does have a nursing program, a bachelor's of science in nursing. And these students may be eligible if they take 1 or 2 more courses to be able to transition. But we really need to look at what we're doing with our ADN students to get them into the BSN programs. And I know that when the California community colleges were authorized to start issuing bachelor's degrees, that conversation started out of the need to issue more bachelor's degrees in nursing. However, after the negotiations, we're now excluded from offering those bachelor's of science degrees in nursing. And so what we need to now do is maybe relook at how we partner to do the lower division preparation and then transfer off and hand off to our Cal State partners in that pipeline for the upper division nursing program to get to the bachelor's degree, getting an ADN along the way. Because it's important that students get a credential at their end of their 2 years so that we know that students who actually hold an associate's degree have lifetime earnings higher than those who just have some college credits, but never actually stopped and got that transitional degree. So those are the conversations, and that's part of what we're doing in our community health professions partnership. Also, about a year ago, we launched our certified nursing assistant program at Compton College, because our Compton Unified School District had a certified nursing assistant program, but had to put it on pause because of the dearth of clinical sites that they were able to get their students in. So we've picked that up under the leadership of our Associate Dean of Nursing Director, Dr. Carol DeLilly. And we have been able to grow the cohort size ever so slowly. And we're looking at a curriculum change to help increase access to the program for the community. Because right now it's in credit, and we're going to move it into a non-credit program, which will actually make the program essentially tuition free for those students to come into certified nursing assistant, which is a gateway into that LVN and RN path.
Thank you so much, Sherry. For those again of you on the webinar who have questions, please drop them into the Q&A box, and we're going to do our best to answer as many as we can live. But I am going to start with the first question that we have in the chat, and it's something that we've heard a lot of you kind of touch on, the fact that, you know, nurses are required as part of their training to have clinical hours, to be in a healthcare setting with a proctor to review, and that there really is a shortage of clinical placements here in California. But we know that it's also a national issue. As I shared at the top of the webinar, my own daughter just earned her Bachelor's of Science in Nursing and did not get a clinical placement in her last semester because of real capacity strains and a lack of proctors at her health facility and in the state of Oregon. So we know that it is not limited, again, to California, but really, you know, a large national issue. The question that was dropped in the chat is how are kind of our other entities, the California Hospital Association, the California Association of Health Facilities, how are these partners coming to the table in a broader way with all of you to discuss this clinical placement challenge, so that we can get students that experience that they need? And if students can't have that, then on the back end, when a student comes into the profession, how do we get them up to speed on the clinical side? So I think I'm looking at both Dr. LANDSBERG and Catherine, whoever wants to start first, and then we'll go to the next one.
Why don't I start first, since what we're seeing it for real right now. You know, again, when we bargain a new collective bargaining agreement, one of the things that we've been saying since, you know, I just finished bargaining our Kaiser collective bargaining agreement, and we say to the employer that you need to invest money in a residency preceptor program, which really has specific standards so that these new young nurses that are coming into the hospital in acute care, that they are given absolute amount of time, 3 months minimum, and certain standards so that the young nurse is learning the skills that they are going to need to be successful. We know this works. There have been studies out there that when you put the money up front with new nurses, what you get is longevity. And again, I'm going to say that of myself. I've been with Kaiser for 41 years out of the 43 years that I've worked as a nurse. And I've gone through training, not once, but 3 times. And I'm still here. So we know it works. So we have that now in our contract to say, if you bring in new nurses, the expectation is that you're going to train them. And other health systems that we have that are part of CNA, and we're organizing agreements, we're doing collective bargaining agreements, that is in our collective bargaining agreement. So that's important, because hospitals can do this. If they value the nurses and the workforce, then they need to really put the money up front, because what you have in the end are nurses that are going to stay. And that's what we want and need. Elizabeth?
Yeah, and I agree. I agree with all of that. So we are looking as a state in what we can be doing to invest in clinical training sites. So Again, we don't want to increase our pipeline, increase our capacity at the schools, and then not have the clinical placements and have folks go through what your daughter is going through now, Audrey. So, and I think the question is an important one in terms of everyone coming to the table, having, you know, the hospitals at the table, the clinics at the table, because obviously they need to invest. So, you know, we're having a lot of conversations right now about hospitals' financial distress situation, and they say, well, we're having to pay so much in traveling nurses. Well, we all have to come to the table and be part of the solution and invest in training and supporting nurses so that they stay. So I appreciate the question. We are, you know, in conversations with all parts of the, again, it needs to be a collaborative approach to providing those training sites and the support to have the students succeed.
Thank you both. We have a question in the chat for Jasmine, and it's a question from some of the individuals on the webinar who are students themselves. And they're asking you what programs or medical certifications helped with your resume, your application to the nursing program at Channel Islands, and what would you recommend to other students to have a seamless experience pursuing a BSN or a nursing degree, especially for programs that are impacted? Obviously, you got one of the coveted spots. What's your secret?
So in high school, I had the opportunity to go into an RP program, and I believe it's called like a career and technical education program. So it's when you get licensing through an offsite program, and I did my certified nursing assisting, I did my medical assisting. I got certified in both of those, and I did emergency first responder as well. So I did that all my senior year. And then I advocated for that and for my students that were my mentees. So I had a peer mentor, and then I was like, you should do this. You need to do CNA. This will let you know whether or not you want to be a nurse. And if that is something you like, you could ask the nurses, you could ask anyone you work with how they got where they are. So it's putting yourself out there in those clinical experiences and those volunteering experiences as well, because volunteering has also greatly impacted our students at the hospital level, whether or not you are doing hands-on experience with as a CNA or volunteering, that is equally as important. Aside from that, I had 8 leadership positions last year. I was in 7 clubs. I had multiple committee positions on campus. I was a senator of student government, and next year I'm going to be, or this June, I'm going to be the vice president of our student government. So that is something that I advocate for everyone to do, to make as much time as you can for your students, to advocate for your peers, to make time for what is important, and to show our younger students and anyone like the same age as you as well that it's possible. I'm a first generation student. My family, my sister, she finished her bachelor's, and I'm the only one in my entire family, my mother's side, my father's side, that's pursuing a BSN. So this is something that I really want to give back to students. I want to create a mentor program for Ventura County for nursing students. I want to do all that. And I wouldn't be where I am without the educational opportunity program. The AOP program on my campus has really contributed to my success because it provided that sense of belonging on our campus. So I encourage everyone to find a peer mentor, to join a clinical or volunteering experience, and to make the most out of your experience anywhere you are, and to ultimately run at any opportunity to get out there and put your perspective and represent anything that you have to offer to everyone, because ultimately you are valued. And I believe that's where everything is with, and it starts with the sense of belonging once you arrive on campus.
Thank you so much, Jasmine, and congratulations to you on all of your accomplishments. And you just such a stellar, amazing inspiration to all of us in the work that you're doing. I want to talk a little bit about the question that now has popped up in the chat about the use of virtual reality to prepare nursing students. Clearly during the pandemic, we saw that, you know, all of our programs, right? Everything from history to nursing to engineering went online, and there had to be an increase in teaching content virtually, but also labs. And we know now going back into, into in-person and real life courses, virtual remains an option, but we also see universities, a lot of our privates, our big public four-year universities have huge simulation labs. I know a lot of our community colleges, because of resources, may not have that same access. But what is the role of virtual reality in training students? And are students at a disadvantage if that's the way in which they're grabbing their clinical hours when clinical placements are not available? SHERI, you want to start?
I'll give it a shot. I'll try. You know, we have only a certain percentage of our clinical experience that can be done outside of the clinical hospital or facility. We're governed by the Board of Registered Nursing, and they approve our programs and the number of hours that we do, for lecture, for clinical experience. And then we do have our simulations. So we are restrained a little bit in how much of that clinical experience can be shifted outside of the clinical and outside of direct patient care situations. I don't have the exact numbers, and I'm not the BRN expert here, so I apologize. But I think that the use of virtual reality is something that we could definitely, we're looking at bringing in, and we haven't quite figured it out at Compton yet, but how do we use it for, say, our anatomy and physiology classes, which are also key to the prerequisites for nursing, to really help students understand the human body. And so I think that's something that we can explore and look at for the future, but I know we have to engage with the BRN as well to make sure that that experience will count in some way. But I can tell you that during the pandemic, our clinicals did not necessarily move online. We found ways to bring students in small groups into our simulation areas to go through and demonstrate the skills, even if they couldn't immediately be back in their clinical sites. I know that prior to Compton College, I was the vice president at another college in the LA district, and some of our students were getting clinical hours by going up to vaccination sites and testing sites to be able to learn the skills needed there. And providing that, getting that clinical experience. We looked at different ways for the students to gain that clinical experience in our mental health situations. Some of those clinicals did remove into the remote telehealth mode because that's how mental health services were being provided. And they were working with a teacher or a faculty member, a clinical faculty member in those virtual remote simulation environments, excuse me. So these are all things that we need to explore, especially as the technology improves, to be able to provide safe learning environments for our students so that they don't do patient harm, right? Because anything can happen in a hospital setting when you're on that floor. But that's why we have the ratios that we have, which is also what makes the experience at the expense to the college so much greater for a nursing program. But we do find value, right? That's why we continue to support it. We just have to find that balance.
Can I jump in and say that when, the students leave the School of Nursing, graduate, and then come in and find a job, and as a new grad entering into the hospital, those are one of the things that, again, investing in the resident new grad program, because we have found that young nurses that are coming in and they lack that clinical experience because of COVID, they need a little bit more time in their training. And so when you have good preceptors that are working with these young new grads and they're talking and they feel that they have a relationship with that preceptor, one or two of them, then they know that we're here to assist that young nurse to be successful, not to kick them out, because they didn't make the grade and they don't know what they're doing. The purpose is that we as registered nurses, the hospital industry, ensuring that the nurse is successful, giving them the additional time that they need. And that is money. money up front, and it is worth the trouble and the value, because at the end, like I said, you're going to have someone that's going to stay within that system and work. They may not be in the same unit, but you're still going to have longevity with that nurse. And it's because of their experience with a preceptor, one or two of them that have really guided them and really worked with them to make sure that they are successful. And it can be done.
Thank you, Catherine. We are coming up on time, so I want to thank everyone for the questions that they've put in the chat. I know we didn't get to all of the questions, but we will do our best to field them out to our panelists to get them answered post-session. I am going to pose one last 1-minute response question to Dr. Reddy. Dr. Reddy, the state of California, as you know, is currently working on a cradle to career data system. And in the report, there were a number of recommendations on the type of data that we should and need to be collecting to continue to inform us where the challenges are in the pipeline and what the needs are across our state. Can you uplift those places that you think are the most important for our state leaders to be considering as the cradle to career data system is being created?
Really great question. I appreciate any question about data. One of the topics nearest to my heart. So some of the things that we don't know, we know that students are applying to multiple programs across the state, but we don't necessarily know to which programs they're applying or how many. And so when we talk about acceptance or rejection rates, it's likely that students who maybe were rejected in one school were accepted in another and maybe found an enrollment, but we're sort of flying blind in terms of the patterns of enrollment and application in that regard. We also know that there are a lot of students maybe who were not enrolled, but they were eligible, and so trying to figure out what are the data on the students who were accepted but not enrolled. Did they enroll elsewhere, right? So a similar question to the one that I just posed. But just sort of a finer grain on where students are going. And then transfer data, right? We don't have great data on sort of the what's working in the transfer pipeline. So those are some of the big ones that I think are on my wish list. I think there may be others that are out there, but you limited me to a minute, so I'm gonna stop there.
Thanks so much, Dr. Reddy. I want to thank all of our panelists for being with us today. SHERI Berger, Catherine Kennedy, Elizabeth LANDSBERG, Dr. Vikash Reddy, JAZMIN GUAJARDO. Thank you all for giving us your brilliant insight onto helping us and our state really addressing the nursing workforce shortage. Again, it continues to be clear to all of us how important nurses are to our collective health. And we have to get this right. None of us want to experience a healthcare system where we are short nurses, where we have subpar care because we don't have those individuals guiding us and supporting us in our time of need. And so I'm grateful to each one of you for your role in this effort. And for all of you joining, I'm so glad that you spent an hour with us this morning learning more about the shortage and opportunities we have to collectively solve the issue. Please download the report, share it broadly, and most importantly, when you are in circles to do advocacy work around healthcare workforce, to make the ask of our leaders to invest in nursing education, to create more spots at our colleges and universities for nurses, to call on companies and our private sector to open up placements for nurses. Please do that. That's all part of the change work. So thanks again for joining us, everyone, and we look forward to seeing you soon. Take care.